messaged me that they weren't able to join today because of kind of family vacations and summertime, which is completely understandable, but we still have an incredible group here. So thank you all for taking your Friday to come together and do an update on So Kids Can Move, soon to be So Everybody Can Move, which we'll share here in a little bit where we're at with the update on that. So as we get started, I'm going to first kind of share a short presentation, just kind of with an update and the agenda items I sent out, and then we'll open it up to really the floor for all of you guys that are leading the efforts in your states, and ask you to kind of share an update. Also, Joy, it looks like I don't have screen sharing ability yet, so if you could enable that, that'd be great. And we'll see kind of how much time we have at the end, but for those of you who are giving kind of state updates, we probably want to keep them short and sweet, although I told Herb he can have the floor as much time as he wants. Just kidding, Herb, but keep it short. So as we kind of go through that, we just have a ton of states that now are in the works, which is great. So we'll probably just kind of have to reduce our time a little bit that way. So, all right, looks like I have screen sharing now. So I'll share kind of this presentation. Hopefully everyone can see that. All right, so as we get in, as I kind of sent out, we're going to start with first kind of going over the survey results. I want to thank everyone so much for those of you who took the time to take the survey on behalf of your state. We've gathered a lot of great information from this and wanted to be able to kind of share this out with you all so you can see what people are contributing, where the initiative is at a high level, and just know that your feedback is being heard and we're listening and reacting to that. And then we'll give you kind of a quick update on the logo, the website, and the toolkit. Give you kind of a brief overview of a partnership that we have underway with On, which is a shoe and apparel company based out here in Portland, if for those of you who have worn On gear. And then a little bit of update on our Hood to Coast team and how you can get involved with that. And then we'll go into our state updates. So in terms of kind of where we're at with the states, I will send out this one pager so everyone can have access to this, but we've had some great updates over just even the past few months. We've got 2 new states that have introduced bills in 2023, which include Minnesota and New Jersey. And Illinois' bill is on the governor's desk. We'll let them, Bukola and Jim, give an update on that later on. But as we had the states kind of listed on this map, we had each of you take the survey to kind of understand a little bit more about where you're at, what your needs are, and what you could use help with. And so we kind of have bucketed all of the states into 3 categories. So there's the states that have enacted legislation and are starting to work on implementation. We've got 5 states there. And then there are the states that are introducing or planning to introduce legislation in 2024. We have 11 states there. And then we've got a number of states that are kind of just getting started, need some guidance, and are still kind of developing their teams. And I've got kind of asterisks here with Illinois because they're still waiting for the governor's signature. And then the asterisks here are bills that have been introduced this past year. So they already have a bill number as we're working towards 2024 or have to be reintroduced in 2024. So one of the big things we asked all of you to share, and you'll kind of see this throughout the presentation, is sharing kind of who your core team is. And this is kind of a really foundational level for everyone, for us to understand who you're working with, making sure you're not on your own, and that you're starting to develop kind of other individuals who can play into this. And I just wanted to kind of note that for the most part, I mean, almost everyone who took the survey has at least one person that's the core team member, which is obviously important. But for the most part, everyone had around 3 kind of core team members, and then some other states had, additional 4 or 5, even 6 people that was part of their core team. So I'll kind of break it into the different categories, first going into the states that shared that they've enacted legislation and now are working on implementation. So I think most of you have gotten to know these individuals over the past year with their updates, but just kind of sharing here kind of an overview, and I won't go into details on every single person in every state, but showing that, for example, like Colorado, very sophisticated team that they put together, and with Angela at the helm as the state lead, and really had kind of very specific roles that each person took on, versus other states in New Mexico might have had to be, a little bit more nimble, and each kind of core team leader wore many different hats. And just sharing that to state that, some states might require, kind of a heftier team, while others you might be able to have just a couple people and that wear a lot of different hats. But this was kind of helpful for us in starting to see what you guys are doing and how you're modeling your states, as we have built out our toolkit to help provide recommendations for states moving forward as well. We also asked every state what organization is going to be kind of the centralized point of advocacy for the state. And I think it has been pretty interesting to see across all the states that some states have organizations, and if they do, they're kind of well established or maybe up and coming ones, and others have not necessarily needed an organization if they don't have one in the state, but kind of were able to create their own coalition of sorts if there wasn't one already established in the state. And this was a big one for us to understand in terms of when do these laws actually go into effect, so that we can start thinking about implementation and making sure that we're getting the word out, because as many of us like to see the governor's signature as the finish line, there's actually another finish line after that, which is making sure the law is actually being implemented properly and that people know that it exists and are benefiting from it. So Arkansas is actually the first state to go into effect here in a few days on July 1st. And so they're busy getting ready for a mobility clinic later this summer that they'll give kind of an update on. Maine, which was the first state to actually have this law signed by their governor, that goes into effect on January 1st, 2024. Same with New Mexico. And then Colorado and Illinois are looking at January 1st, 2025. So we have a little bit of time. So when we ask the states who are working on implementation, what support do they need from us? We got some really great feedback. As an example, it'd be nice to begin a national conversation with manufacturers to discuss pricing, coding, and available devices for recreation. There's definitely a need for kind of education around that. Creating and distributing a fact sheet to O&P clinics and also people living with limb loss and limb difference. Beginning kind of discussions with insurance providers and kind of those payer relationships. Communicating next steps to O&P clinics, kind of what to do next, resources that they might need, and also working kind of on the next side of this, which is Medicaid. So kind of lump those into 4 buckets that you can kind of see below, including kind of communications, payer relationships, coding, billing, and expansion to Medicaid. So those are things that we're focusing on to help support these states as they move forward. For the states that are planning to introduce legislation in 2024, we've got a lot of you, and we're both excited and also kind of ramping up to make sure we can support you all this coming year. So kind of core team snapshots. I think for the most part, all of these teams have a pretty hefty group of individuals that they've already kind of assembled. Some are still kind of working on developing their core team, and we're happy to help kind of connect you with other individuals in the state on that end as well. I would say kind of half or maybe 75% have an established organization that they're going to be working with in the next year. So if you don't have one listed, we can also help you kind of get connected to potentially a group that might be able to help with some of that disbursement of information. And I think that was an example that Colorado did an incredible job at all the different sign-on organizations you guys had and just the coalition building. And so that was a key point here is even though you might have one organization listed, you definitely want to have lots of organizations that you're getting involved to get the word out. This was an interesting thing as well to look at of the states that are introducing legislation next year, how many of them do not have insurance fairness laws? And this is important because we've been really working hard over the past 20 plus years with the Amputee Coalition taking the lead on this to get insurance fairness passed in the majority of US states. And so 5 of the states that are planning on introducing the bill next year do not currently have insurance fairness. So that's going to be really exciting to watch that. And if we can get those bills passed in these states, we're not only tackling the physical activity side of this, but we're also adding insurance fairness to the mix. And right now there's 21 states that have insurance fairness. And so that will push us over the 25 mark, which would be incredible, because then that really starts leading to that kind of federal conversation. We also asked, of the states that are introducing legislation this upcoming year, how many of them will be working with a lobbyist? We had 3 of the 10 say that they're going to be working with a lobbyist, and majority of the states are still unsure. And so this is something we definitely want to, kind of chat with you all about and see kind of where you're going to be providing legislative support or lobbying support if you're not working with a lobbyist. This was also kind of a snapshot at all the bills. And I think I will send out these slides afterwards so you guys can really look into this in detail and kind of start comparing with each other. This is obviously just preliminary. We've some of these, I guess only 3 of them we have actual bill numbers for. So that's where you know for sure what's included. But this is kind of what the states are thinking about including. You'll see that most of the states are pursuing orthotics and prosthetics in the bill, so including both of those. Most of them are also pursuing all ages, and really that's kind of dependent on your state and kind of the political environment. Most states are pursuing commercial plans. A few, like Indiana and Tennessee, are considering Medicaid. New Jersey also includes state employee plans. I'd say we kind of already went over which bills already have insurance fairness, but of course, all of them are including physical activity and exercise. Some are considering adding kind of showering and bathing prostheses and orthoses to the mix, kind of expanding or redefining medical necessity, adding non-discrimination standards, and adding reimbursement parity. And so this is something we wanted to get a sense of to understand both how we can guide you and what to include and what not to include. And we've been having conversations internally with our partners in terms of kind of what is our core model legislation versus kind of an expanded version of the model legislation, and making sure that states aren't biting off more than they can chew. If you are adding so many things on that either A, is just not going to get through in the legislature, or is going to add a ton of committees to your bill. So that's something that we're going to want to make sure that everyone's mindful of. And of course, supporting states that want to shoot for the moon and go for everything. But for other states that might not be sure, maybe being a little bit more conservative with what you have. We also asked, what support would you guys like from our team? And resounding, kind of the number 1 was the legislative technical assistance. So for selecting the model legislation, the bill drafting, and potentially any amendments that might come through for the bill. Tied in second place was creating the fiscal and social impact report, which is not surprising. That's been a really big one that's been really helpful to all the states. And same thing with kind of marketing and communications templates for the fact sheet, the policy brief, intake forms, kind of media relations, that is. And then I was glad to see that the 4th one that everyone was interested in is attending these lead advocate calls. So that's great to hear that this has been helpful and you guys continue to want to see this happen. The other question we asked is, do your core leaders have enough time or bandwidth to take on this effort in your state? Because we want to make sure that we're being kind of upfront with expectations of how much time this takes. And this might actually be something we would love to survey the states that have already done and implemented the legislation this past year, of how many hours you felt like it really took to get this bill passed. But just wanted to call out that there were a majority of the states that are kind of unsure whether they have the bandwidth. And I think that's where we want to make sure that you're assembling a core team of individuals and spreading the load appropriately versus trying to take everything on yourself. And that's kind of suggested here as well in the comments in terms of needing additional advocates or, needing other materials and resources to support you. And then finally, we've got the states that are interested but need guidance. The ones that are in kind of the brighter yellow are the ones that completed the survey. The ones that are in this lighter yellow did not complete the survey, but we've had conversations with them and they are interested in getting something started in their states. So these are the ones that are kind of just getting started. You can see a few states are still figuring out who their teams are going to be and kind of looking at that. Same with kind of the organizations. A lot of them are still kind of identifying what organization might be a centralized point for them in the state. And then kind of asking them, and I think this was kind of for everyone, what support you might need. Really, some of the big ones we're continuing to hear from other advocates. In one case in California, kind of still trying to understand if this is something that's going to benefit them. And that's a really important thing for us, is we want to make sure that you all are assessing within your own state, like, is this needed? Is this something that is important to you and how it should be implemented? We don't want to be coming in and telling you all what to do. Identifying kind of numbers, kind of the data, supporting on the ground effort, helping to build the right team. So we really kind of encapsulated all of this feedback into kind of 4 main things. 1, the legislative technical assistance, the lead advocate calls, the fiscal and social impact report, and then of course the toolkit, which we've been kind of sharing with everyone, and we'll give an update of that kind of coming down the line here as well, to provide kind of a step-by-step guide for people. Overall feedback, we had some great feedback. A couple shout outs to Shanice as well for her work in the fiscal and social impact report. The toolkit, some really nice comments of, the kind of national leadership, which is great. And I also appreciated this comment, which I think was from Bucola, of, the name and the marketing of the campaign being so important, and really making sure that children are front and center. And even though we're moving away from the initiative being called So Kids Can Move, I think it was really important that we started the initiative with that in mind, because that will forever be part of our identity, and sharing and showing how important it is to have children front and center in your testimonies and materials as well. So that's something I kind of wanted to shout out there. And then of course, fundraising being a big one as well. So we kind of encapsulated these into 4 main points: the fiscal and social impact report, the toolkit, fundraising support, and coaching, as being kind of 4 main areas that we would love to be able to help you all on. And I kind of highlighted one here, which I think maybe Angela, that might have been you that shared this, about creating a task force to discuss and strategize around building the case for a federal policy, which I love that as well. And that will be something a little bit more down the road. So that's kind of the kind of section for survey results. If anyone, I can kind of open it to the floor before I dive in to the next part here. If anyone has any comments or anything they want to share based on the survey, I will also send out those slides after this. So you can kind of dig in a little bit more, and feel free to email us with any questions. Yeah, Shanice.
Hey, can you hear me okay?
Yep, we can hear you.
With a little bit of my service being an issue today, but I just wanted to, well, first of all, thank you. And thank you to Lindy, Angela, everyone that helped me with that report. It's definitely a team effort. So I really appreciate the kudos, but I got to give kudos and kudos are also due. Also, I was meeting with a state representative this week, kind of picking his brain, as he was a speaker of the House at one point. What's next, right? Like, we put the bill in place in Colorado, what he would recommend. And he ended up sending me a lot of great information on, staying up to date with the committee that's in charge of implementing, and how to do that on a regular basis, attending their meetings that are public, and how critical it is, almost as critical as the initial, pushing the bill itself, which was a surprise to me, to be honest. So I just wanted to put a plug into that. I can definitely get you in touch, Nicole, whomever that's helpful. It was just an initial conversation, but he did agree to meet with me again to kind of give me a little bit more details on what that support could look like. But I thought that was helpful and new.
Awesome. That's fantastic. Would absolutely love to open that conversation, because what we've seen with kind of the legislative and advocacy toolkit we're building, we're realizing we're probably going to need another toolkit, which is for the implementation side of this. So the more that we can learn from you all as you guys are building this out, and for individuals like the individual you met that is an expert in this, we would love to gain more feedback on that.
That call up, I'll include you and whomever your team, I would assume Kyle and obviously Angela and our Colorado leadership team. So that will be TBD for me.
Great. Yeah, I would love to include Sam and Joy on that as well. All right, Cheryl.
So I want to say, as someone who's very early in this process, this was really cool to see, and especially because just the support that y'all from AOPA has been giving has been wonderful. But the fact that there are states who are willing to really kind of share what they've learned along the way is awesome. And so kind of going along those lines, I don't know if this would be part of the toolkit or whatnot, but if there might be a way that AOPA could almost organize some sort of like a buddy system where like a state who is really new and has questions could be matched with someone, again, obviously if they're willing, but with someone who has kind of already gone through the process or who is further along with the process, recognizing that states, all the state legislatures all work slightly differently, but just someone who's kind of already gone through it that can give feedback on, well, this worked for us and this didn't work for us. So kind of having like that buddy person that you could reach out to on a more frequent basis than me spamming your email every 5 minutes, Nicole. So
Yeah,
I don't know if
absolutely.
anyone else would be interested in that.
I love that idea. If anyone in the chat is interested in that and being a buddy, feel free to add that into the chat. And I think it would be interesting to kind of, I mean, there's many ways that you could organize the buddy system. It could be regionally with another state that's in kind of your area, or kind of what you said, maybe having similar legislatures or kind of makeup of the state that way. But yeah, I love that idea, Cheryl. Joanne.
Sorry, I had to unmute. So my apologies. So I guess I have some questions or concerns about. I know that you can't change different states' legislation, and what they put in for is really up to them. But I guess my concern is I don't want to muddle what the goal of this goal is, and to throw everything else into it, like shower and that sort of stuff, because that's not really the focus. I mean, sure, you, like I said, you can't tell a state what legislation to submit for, but I just don't want it to reflect back on all the hard work and efforts that all of you have done. So, is the plan to really give them some guidance and to make sure that they kind of separate their asks? I mean, I guess that's my concern from what I just heard.
Yeah, I'm glad that you brought that up. And I know, Ashley, you probably have raised your hand because we've recently met on this topic to talk about the model legislation and kind of seeing what's going on in the states in terms of kind of adding, we're kind of seeing states kind of morph things outward and trying to figure out, how do we make sure there's not mission creep? How do we make sure people stay in focus, and kind of making sure that they're aware of the pros and cons of adding a bunch of things in. Ashley, I'm not sure if you wanted to add additional to that.
No, I think it's important to know that we will have two versions of model legislation. One is hyper focused on the legal language that needs to happen in order to create opportunities for people to get access to physical activity. The bigger piece of legislation also will come with the caveat that you have to be prepared to speak to these separate provisions. And so the conversation that Nicole and I and the team had around this was like, if you're going to include this additional piece, it comes with a responsibility to also understand the policy gaps and the what is actually happening in that state on the ground, where people's access is impacting the lives of the individuals in those communities. And so if a state does choose to go for the big package, that adds those layers of the work that's required. And that is covered in the toolkit. So 100%, you're absolutely right. Like it complicates the process when you add additional provisions, and that is true for states and for federal language. And what we see in some states is they choose to do it in an iterative process. Virginia is a great example of a state, as is Maine, where they've gone back to their insurance fairness law over and over again, and it's been an iterative process of additions. So that's also an approach. But that I think that's the detail there.
Yeah, so I'm glad you brought that up, Joanne, because I think that is an important thing we want to emphasize in this call for the states that are looking into that and making sure that they're reaching out to us to provide guidance and kind of chat it through, kind of what are the pros and cons, and kind of working through that together.
Exactly. I mean, and not that I'm not that wish they all covered everything. I'm not saying that's not important, but I always think of when this passes, what the cost, the way that the insurers look at it is, what is this going to cost us? We all know it's going to cost them something, but if we keep adding and adding, then all they see is zeros and zeros, and that's not a good thing.
Yeah, and that's something we can definitely discuss with Shanice, if Shanice is still on the call, about, the fiscal and social impact report. I think that's an important thing to think about, is how adding these provisions would impact the fiscal and social impact report and how the cost is assessed. I mean, right now it's pennies on the dollar of what they're estimating, but by adding additional items, what is that gonna elevate things to, is a good thing for us to think about.
Thank you.
Yeah, thanks, Joanne. All right, we've got two others, and then we'll keep moving on with the agenda. We've got Angela first.
Hi, everyone. I'm just going to comment on a couple of the things that were said. So I agree. I think from a national organization and support standpoint, it's helpful to have model legislation that's a little generic and that does kind of cover all of these things if people want to, but clearly each state has to make those decisions themselves. I feel like that early on, I was making decisions that felt very big, like, okay, people would say like, well, you just decide, it's your organization putting it on. And I'm like, well, but what are the pros and cons? So every state's going to have to do a real deep dive and be drinking from a fire hose a little bit to understand the climate of the politics in your state, to understand there are laws that exist in your state that don't exist in others that would create barriers. So I think from an AOPA standpoint, you can just provide this framework or scaffolding that then people will have to select from. So that was helpful to me to know. I mean, we were going off of Maine, and then we took a couple turns off of that based on our existing situation in Colorado. That's one thing. The second thing, I love the idea of the buddy system, and I do think that it would be really helpful for it to be regional. I remember on one of these calls, Indiana and Illinois were like, hey, this guy's my neighbor and we do this thing, I think that it's interesting regionally how there is a lot of crossover between not only O&P clinics that may cross over state lines, but personal relationships, people who know politicians, know the climate. I think it's really helpful. So I know I was recently contacted by someone in Utah, and I think that it would make sense to help people regionally if that's, I don't know, at least it seems like that seems fairly organic. And then the last thing, Shanice had mentioned early on about, kind of implementation. I know during the advocacy policy forum, I met with Kyle and we kind of started putting down some ideas on that. And I do think that is going to be a huge undertaking. And I think just like all of this, I think the more we can create a toolkit, like you said, Nicole, to have like a separate toolkit for that, I think it's going to be crucial for the success of these laws to actually be super on top of implementation, what's going to be needed. And I think we have a sense of what those things are, but creating those teams and working with the people in your state to educate and make sure that this is, rolls out as smooth as possible that's my next big priority. So those are my comments.
Yeah, I love to hear that. And Angela would love to work on that with you. I think something that's really cool about this initiative is that it's such a living, breathing entity. So even when we share our final kind of advocacy legislative toolkit, we would love feedback on how we can make it better and just continuing to iterate on this as we move forward. And to your note about the regional concept, I love that idea. It made me think of B. Mathis, who both testified in New Mexico and also Colorado. We called her our like traveling advocate. She's put on quite a few miles, but I think that's a great idea because there is a lot of crossover between people working in different states and just the similarities in the legislatures as well. Colleen.
Yeah, hi, I'm just a comment as how does this cross-reference with the ADA? I mean, the similarities are so similarity to having, accessibility, but how is the language similar and different? Someone asked me that, and I just was like, wow, why wouldn't this automatically be included in the ADA?
Yeah, I think that's where we're going to need a deeper dive and kind of legal analysis, which we could probably ask maybe Peter Thomas and anyone from NAOP. We'll put that in your ear, Maggie. But Ashley, I don't know if you have any thoughts or perspective on that.
Yeah, I'm happy to. I mean, the ADA is a really complicated piece of legislation, and unfortunately, it's actually inadequate as it's written. It fails on a regular basis in just not normal community settings. And so while the discrimination language is something that states have pointed to and have used, New Mexico specifically looking at ways in which they can include non-discrimination language to expand access and expand their bill, which I would encourage everyone to consider, right? If that's an angle you want to take. Existing Affordable Care Act law, existing ADA law, those requirements don't create responsibility on the payer's part to reimburse or carry coverage for prosthetic devices. It's not part of their language. So that's where the disconnect happens.
And I'd be happy to share, this was back in 2020, Forrest Stump, a nonprofit, created a policy brief on the rights of Americans with disabilities to exercise, which really started looking at the shortcomings of the ADA and other policies. So if you really want to dig into it, I think that brief could be something that is at least a first start of understanding where the gaps are and how this relates to the ADA as well. Okay, awesome. I'll keep moving along quickly with the next few updates, and then we'll pass it over to the states to give your updates. So as we had mentioned, I think the last caller, maybe the one before, well, first of all, we got some great polling and feedback from all of you that you all felt that the So Kids Can Move kind of naming we'd really kind of outgrown that, considering the majority of states that have now been enacted have legislation for all ages. And so that was creating some confusion for people and even understanding, who does this law apply to in my state? And so we are moving from So Kids Can Move to So Everybody Can Move, and really emphasizing the importance of looking at this and emphasizing that word body in terms of, disability and disability rights. So we'll have a final logo within the next 2 weeks that we're excited to show you all. And we're kind of the action item here is that we're likely next week going to be sending out a poll to get your feedback on which iteration of the logo you would prefer to use for your state. So there's basically kind of two different options. One that centers the state kind of in the logo itself. So it would say something like, so Colorado can move, or so Utah can move. Or another one that's like, so everybody can move Utah, or so everybody can move Connecticut. And so we'll share that with you all and kind of see and get your feedback on which of those you prefer to use. And then in terms of the website, that was something that you all had asked as a resource, and we're excited that we're working on that website. We'll have something kind of by the end of August, early September. And one of the action items here that we would love to lean on you all is to get some great imagery or photo assets to use on that website. We're really kind of crowdsourcing the imagery that's going to be on the site, because the initiative itself represents people from all across the country, all types of organizations, all types of people. And so we would love if you guys have any images that you have ownership of, Make sure you're not just pulling them off of the web and sending them to us. But if you have kind of ownership of those assets and you want to be able to provide them. So for example, what we're looking for is really individuals with limb loss and limb difference who are using activity specific devices that can live on the website and really communicate the initiative of so everybody can move. And we're looking for things that, you know, aren't just Paralympic athletes. We're looking for everyday athletes. We're looking for children. We're looking for older adults, diversity of individuals, racial diversity, gender diversity, all of it. So if that's something that you're interested in and have access to provide, we would absolutely love to work with you to make sure that those can live on the site and that this site is really a living, breathing entity that we've all contributed to. And then in terms of our toolkit, we're in the final stages of editing that, and then we'll be sending it to a designer. And then we hope to have our kind of final version by mid-July. And again, like I said, would love to get your feedback on that as you start using it. What are the gaps? What could we, you know, further improve for it? Also wanted to let you all know that we've had this really beautiful partnership that's come together, and many thanks to Kyle Stepp and his relationship with On. And they have a social impact program called Right to Run, which obviously has many connections to the work that we're doing. And we will be doing an event with them at their headquarters this coming week on Tuesday, June 27th. Their co-CEOs are going to be there. And they are also financially supporting the initiative through the Right to Run social impact program. So if any of you want to watch that virtually or have friends and individuals that you want to share this with in Portland, I'll drop a link in the chat here in a second, and would love to have kind of spread the word and get the word out on that. So we'll be screening the 1500 Miles film that Forrest Stump produced. And then we'll have a panel presentation with myself, Kyle, Sarah Mae Hollinsworth, and Zach Friedley, who's a sponsored trail athlete by On, and all of us are individuals living with limb loss. On that note too, On, like I said, is financially supporting the initiative and is supporting our Hood to Coast team. So last year we had a team of 12 athletes with disabilities compete in the renowned kind of Hood to Coast relay, which is a 200-mile, 36-hour relay. Travis Ricks was on that, and don't let him tell you how hard it was. I know that he was a trooper for all of it. And it was a really fun time with the group, but not only that, we were able to get the word out through Outside Magazine, publish an article on our team. And this was really our first opportunity to launch So Kids Can Move at that event. And so this year we've got another team of athletes that we're going to be having. And our goal is to raise $50,000 for the initiative. And so all of that will kind of come back to supporting you all in the States through our consultants, and through hopefully other grants that we can provide to the states that need funding support. These are just a few of the athletes. The whole team is athletes with disabilities. Majority are individuals who use prosthetics. And we've also got a number of brands who are on board in supporting our team this year as well. So I'll share the link to that, but if any of you have connections to brands or thoughts on how we can, you know, support this team, other brands as well that might want to donate gear or donate financially, we would love your support on that. So that is the kind of main portion of the kind of update part of the agenda, and would now love to pass it off to the states to give some quick updates round robin for those of you who are here. So let's see, the first state we have on the list, I think, is Arkansas, and Francois, I believe, could not make it today as he had a patient running prosthetic appointment, patient running late, but I believe Sam's going to give an update.
Yeah, just to keep it kind of short, Arkansas's bill has been enacted, and it will be going into effect in just a few months. So Francois, along with the So Everybody Can Move partners, were trying to plan kind of a mobility clinic for kind of to raise awareness of the bill and to make sure that folks understand how it should be implemented. This is going to involve, hopefully, manufacturers, providers, and then bring a lot of patients as well. And we're also looking at involving insurance providers, the state's insurance office as well, just to make sure that everybody knows what the bill is and how it works and how best to implement it in a way that impacts patients the most.
Awesome. Next we have Colorado and Angela.
Okay, mine's going to be very short and sweet because we don't have too many updates. We since the pass of our bill was in May, we all took a month off and just we're breathing a little bit, including our representatives and sponsors. So we the only thing that has really happened tomorrow, we're having a celebratory event for all of the it's being hosted by CCDC, another organization here in Colorado, and it's celebrating all the bills that passed that were disability rights oriented. So our bill with RMOPC will be one of many that will be presented there. So that event's happening tomorrow afternoon, and we're sponsoring that as our coalition. And then beyond that, we are organizing our annual educational meeting from our coalition standpoint, which will have an advocacy tilt to it, but that won't be the main focus. And then we are doing a fundraiser as well. So we are just this week have decided on a date and a location for the education portion, but we are still working on the fundraiser date and location that will be specific to so Coloradans can move and our advocacy efforts moving forward. And then the only other thing that's happened, and I don't have a date for this yet, is I have initiated a meeting to discuss the steps for Medicaid with a couple of the other disability rights folks in the state. So they that includes the CCDC folks. Mostly as an educational opportunity for me to understand what those next steps look like and who needs to be involved.
Excellent. Well, that's great. I mean, you guys have a lot going on there. And I think those 4 things are definitely pillars for other states to learn from, of having the celebration, having the education day, having a fundraiser, and then of course, kind of looking towards Medicaid as a next step as well. Awesome. All right, we've got Illinois and Jim Kaiser and Bucola.
Thank you, Nicole. I don't see Jim on. Jim, are you on?
I think he was on via phone, but he might have dropped off.
Okay. All right. So I'll just keep it moving. Happy Friday, everyone. So we have more great news. Our bill. Oh, there he is. Hey, Jim.
Hey, I'm sorry, I was muted. Yeah, I can just say, you know, Illinois was fortunate. We've had an Insurance Fairness Act, as we've talked about before, which really paved the way for SB 2195. Really, the critical factor here was our lobby impact. His legislative contacts. So we were fortunate to engage Bucola, who had brought in some new relationships. And that's honestly the main reason this passed. Again, having it attached to some previous legislation certainly helped. One quick comment on the buddy system. I've actually had some discussions with Eric in Indiana and Kurt Bertrand up in Wisconsin. So I think that idea can be very beneficial, especially on connecting border states. Bucola, kind of give them an update as to where we are now, maybe,
Sure.
with our legislative
Absolutely.
stuff.
So in Illinois, once a bill has passed, there are 30 days that the General Assembly has before they send it off to the governor. The governor then has 60 days to review, veto, or a mandatory veto the legislation. So right now we are at the second stage, where the General Assembly has sent the governor the bill. So that was sent on June 9th. And we are currently in the process, I am currently in the process of pitching the administration a celebratory bill signing. So Nicole, thank you for mentioning my comment about how important the name is of the campaign, So Kids Can Move. I'm attached to it also because in my pitch, Jim has been able to get Lurie's Children's Hospital to agree to host the bill signing ceremony if we're able to get it. So the governor is inundated and swamped with requests, but the fact that we have tremendous support, tons of co-sponsors have signed on, and it's bipartisan. It's a bipartisan effort. We're keeping our fingers crossed that we'll have a bill signing ceremony soon. So if the governor doesn't, if we don't have that ceremony, then it will probably be auto-signed. It'll automatically go into law, and then it'll be effect January 1 of 2020. What was that? 2025, Jim? Was that? My memory.
2025, I believe. Yeah.
Correct. So that's our update.
Fantastic. That's great. Well, please let us know if we can help get the word out for that celebration. If that ends up being a go, we definitely would love to see, individuals with limb loss and limb difference there at the event. And of course, we'd love to get some photos too. I forgot to mention that we, in addition to photos of individuals being active on the individuals with limb loss, limb difference being active on the website, we would also love photos from you all during the kind of legislative process or ceremonies or the hearings. We're going to put those on the website as well, and there will be kind of each individual state pages. So if there's photos that you really love from your team that you want to highlight, we'd love to include those as well. So awesome. That's great. Thanks, Illinois. All right, we've got New Mexico, and I believe Kyle and Laura weren't able to join today. So Sam, if you'd be willing to give a quick update.
Yeah, definitely. So in New Mexico, Kyle is working on kind of the implementation phase for HB 131. This is kind of centered around Medicaid, especially at this point, and kind of expanding this coverage to the Medicaid program. And then also kind of ensuring that the private insurance companies that are affected by the bill that was passed have things in place to get things done once it takes effect, which should be in January. And then in addition, I believe Kyle's also doing work looking at mobility clinics as a potential kind of celebratory implementation awareness raising event. And that would be potentially a partnership with Lululemon, which is pretty cool.
Awesome. Yeah, I think that's a great opportunity for us to continue thinking about brands that we can bring in on this to help support and get the word out as well. I think those partnerships cannot be, understated, especially the concept in Colorado of including CCDC, and the more that we can partner with other outside entities, the better that it will get across to everyone else. All right, moving through, we've got New Hampshire next under our section of kind of groups that have introduced legislation. And I believe Sam's going to chime in for Senator Sue Prentice, who couldn't make it today.
Yes, so their bill, SB 177, it did not pass during this year's session, but it carries over to next year. So I believe Sue gave us some kind of a forward-looking what's next, and the bill's in committee. It's waiting for an insurance mandate review, and hopefully it will be able to kind of move out of committee for a Senate vote early next year. And I just also wanted to shout out Maggie and Paul Jenkins and Hanger have been helping out Senator Prentice a lot, so I just wanted to shout y'all out as well.
Awesome. It looks like Arlene dropped off, but if she was still on, I asked her to give a quick update before she had to go. Sorry about that, Arlene. I think Eric, I don't believe Eric from Indiana is on. So I guess the next one would be New Jersey. And if you're willing to give a quick update on that again, Sam.
Oh, yeah. No, just going through like the list. But yeah, so that is Steve Slawinski from Boston O&P. He's working with a senator in New Jersey to kind of learn about the committee timelines for the bill that's just been introduced a few weeks ago now, and kind of trying to figure out the kind of the witness process, how to get the most effective testimony in for the ceremony or for the hearing. And looking for co-sponsors. I believe he's reached out to you, Shanice, about the fiscal and social impact reports. And aside from New Jersey, he's also assisting in a few other states. He's kind of working to direct folks to groups that are already working on bills in their own states. And that's including Pennsylvania, where he's working with their or O&P Society as well. He's got a lot going on.
Nice. Yeah. Kudos to Steve for sure. All right, Terry, I know you're on the call. You're up.
Okay, thanks, Nicole. I'll try to keep it at that 2-minute mark. Like Nicole said, shooting for the moon. Some of us are going to shoot for the moon. Minnesota is shooting for the moon. We are following the New Mexico bill, and thanks to Kyle, really set it up nicely. Minnesota was able to introduce its bipartisan bill in the House and the Senate in late May. In fact, it was either the second to last or the last day of session that we actually got our bill numbers. In Minnesota, it's called jacketing the bill. So we have jackets, we have numbers. We are very excited about that. And we moved forward even at the end of the session because we have the support of our governor. He has specifically asked us to work this, which is a really nice place to start, especially when we're trying to get co-authors. Minnesota works off what's called a biennium legislative process. It's a 2-year process. So getting it in this summer and getting it jacketed means that we can work on it this summer into the fall and then hit the ground running literally in the first week of February when we start session again. The 4-part bill, we have a 4-part bill in Minnesota, again, modeled after New Mexico. So we've got insurance fairness, we've got O&P exercise equipment, we've got O&P shower bathing equipment, and we've got the prohibition against discriminatory practices and the provision of O&P care. We are fully loaded and pretty darn excited about it. I did hear some of the reservations of that were voiced on this call about, putting too many eggs in your basket, so to speak. I think that we have to also be cautious and recognize the fact that most of the states that have had success or are having success already have insurance fairness. For those states that don't, this is going to be a much bigger mountain to climb. So we in Minnesota had already tried to put forth an insurance fairness bill 10 or 12 years ago. We worked that for a few years and did not have success. However, we have had success with 2 of the 3 other bills that we have introduced in the last 10 years in Minnesota. So we're just going back and we're going to start again with insurance fairness. These are all mandates. They're mandates. So to be in a state that doesn't have insurance fairness or isn't starting insurance fairness, every state's different. I'm not saying it won't work. It worked in Maine. It's certainly New Mexico got the whole ball of wax in, but it's going to be a different mountain to climb. Minnesota has a team led by MSOP. So we have Minnesota Society, and we're supported by Wiggle Your Toes, our nonprofit amputee group. We have a lobbyist. We have licensure. We do not have insurance fairness. We have a process that's required in Minnesota that we will be working through starting this summer with our insurance commissioner, which it's labeled something specifically like the 62J process, which works specifically for mandates and does a lot of the same work that Shanice can provide to you, which looks at a fiscal and a social impact and creates a report and actually provides to our legislature the numbers, the dollars and cents of how these provisions will affect the state if we have the provisions passed in the state of Minnesota. What else can I say? These calls that are led by Nicole and AOPA and our sister organizations are fantastic, are critical, have been. I don't think we could have done what we had done with the speed that we did it, working in April and May, without all the help and support and the resources that you all are providing. And these calls are essential for us to work off one another, find out what's going on. And so I just want to say thank you to Nicole. Thank you for the OPA staff, who's predominantly carrying a lot of this work, at least the calls. Thank you to the sister organizations who are part of this, because it is absolutely a team and a profession effort. And I just want to say thank you, and we are grateful in Minnesota. Okay, done.
Awesome. Thank you, Terry. And yeah, it's been incredible to see how all of us coming together and each piece that each person is contributing has led to this success. So we're just so thankful for you all in Minnesota, and kudos to all the groundwork that you guys have done in Minnesota year over year over year. I mean, you guys have established, even though you don't have insurance fairness yet, you guys have a really strong foundation that you're building off of, that you have been at the helm, Terry, for leading that. So kudos to you. All right, Connecticut, we've got 3 minutes left in the meeting. I know we're probably going to go over a little bit, but we'll keep it short. Herb.
Keep it short. Yes. We just launched our campaign that I'll call it the 2024 campaign. And we call it that because Connecticut session just ended earlier in June. So this is how it works. There's different ways that we could connect our legislators, either first by phone, followed up by some of the information that we've gathered, or the other way around. It becomes a personal thing, how you're comfortable with. For myself, speaking to the newbies, this is what's worked for me, is to call first and send second. And I don't know if you're going to give me enough time for this, Nicole, but I was going to go through the script of 8 sentences that I used. Is that okay?
Why don't we build that into the next meeting? I think that would be a great opportunity if you're willing.
Contacted a local camp called Camp No Limits, which has it's a camp for people with disabilities. They're supported by a physical therapist group out of Quinnipiac University, and there we will recruit parents and kids for our campaign. We also wrote to potential allies already, and that includes, we're very fortunate, Ted Kennedy Jr. is a Connecticut resident. And he is a former legislator, so he has a lot of influence there, and we've reached out to him. We know of others from our previous campaign 6 years ago, to reach out to young adults very much, and active adults for our campaign, so that they're going to be prepped in time for 2024 when we do the hearings and all that. So we've just got started. We hope we're doing it the right way. Our initial contacts seem to be very positive and supportive. So we're started.
Fantastic. Thank you, Herb. And definitely would love to build your script into a future call, and kind of training session would be great. And I know we're at time now, but for those of you that can continue to stay on the call, we would love to continue to hear everyone's updates. But if you have to jump off, obviously understand, and we can think about either making these calls a little bit longer in the future, or kind of shortening our agenda items now that we have so many states that are here to give updates. Arlene jumped off, but now we've got Travis in Idaho.
Yeah, I'll be real quick. This is all very new to me. I'm trying to obviously navigate the legislation process. Here in Idaho, we do not have prosthetics parity, so looking to include that and the insurance fairness stuff, with also adding orthotics into it. One of the other things that I'm really stuck on here is I started a nonprofit for all disabilities, all physical disabilities. And so I come from a background where I want to support the entire community. I know I'm an amputee myself, but I want to find a way to bring in, sports needs for those who are dealing with, like, maybe say a wheelchair user or orthotics users. So trying to figure that out. But first, foremost, want to make sure that I'm in line with what we're doing through the prosthetics, because that's the closest, nearest, dearest to my heart. I've already established a possible lobbyist. I've been spreading the word with our O&P clinics locally. We have very close relationships with all the adaptive groups in the city of Boise and throughout the state. And everybody has seemed to be very supportive and positive with what we're wanting to do. I have met with the mayor actually last 2 weekends. It's just been serendipitous that it's happened. But I've met with her, and I've also met with her accessibility team for the city of Boise. And I think they're going to be very supportive of what we're doing. Biggest thing for me is, a neat checklist with a basic timeline for the way the legislation works, is so that I can kind of start hammering those things out and start bringing in people kind of help. Because right now I think there's about 2 of us that are slated to help with this, but I really am, not sure exactly the first steps to take outside of telling people we're doing it and really letting them know that, this is something that we're moving forward with and seeing if they want to get on board.
Absolutely. Travis, great work on the groundwork there. And I believe the toolkit will be helpful to paint the bigger picture of the timeline and kind of legislative next steps. So as soon as we've got that, we'll be sending that to you to dive into. All right, we've got Maggie in Massachusetts.
Yeah, thanks, Nicole. So in Massachusetts, we have the MSOP, which is the Mass Society of O&P Association. And we recently met with State Senator Mike Murator, who actually one of our clinicians happened to know from the senator's wife. Is actually, her office is in the same suite or the same building as the Hanger Clinic. And so that's how we made the introduction. We had a one-on-one meeting with him. We were talking about several issues that the MSOP is dealing with in terms of providers and patient access to care. And we obviously wanted to talk about so everybody can move, so kids can move with them as well. And he was very receptive to it. He instantly went back to his office and worked with his assistant on getting something put together and drafting. And so the latest we heard is that they said, thank you for sending this over. Our House Counsel is still working with us on a draft. Once completed, we will share it with you before filing. And at that time, we would need to have a fact sheet. So thank you, Nicole, for sending me that template. We're going to work on putting that together, as well as kind of a quote unquote selling paragraph for other members of the legislature so that we could get some co-sponsors. So we'll be working on that as well. And then it says we'll also need a letter of support or testimony once the hearing is scheduled. I don't think we're going to have any trouble getting people available to testify, both patients and clinical staff. So we should be good there. And we will definitely keep you posted as things roll along. So thank you.
Fantastic.
And Shanice, I will need Shanice, your help if you're still there.
Everyone wants Shanice for sure. And Maggie, would love to make sure that you guys are connecting with Dave McGillivray and the Boston Marathon group. I think they would be powerful to have on board in some capacity, and we can start working our connections on that.
Definitely. Yeah, that would be great.
Awesome. All right, we've got Ohio, Kaylee and Autumn.
Yeah, so Autumn and I have been working really closely with Shanice, actually. She's a popular person, it seems. But to support the idea of the buddy system, we would be hundreds of steps behind where we are now without her coaching and guidance and bi-weekly meetings. So definitely support that idea of having someone who's navigated the route before. With that being said, I do think it's funny someone mentioned regional versus not regional, because some of the many roadblocks that we've been coming across, I think, have to do with how Ohio is just very fundamentally different than Colorado as a state and in the state government. We just realized that Ohio is a biannual session and not an annual session, which kind of put a little bit more fire into getting in earlier rather than later, because if it doesn't get through by the end of next year, we have to redo it rather than just a one-year session. But we also had issues with data. So we were talking to Shanice originally for the fiscal data, and an all-payer claims database is where Colorado got all of their data from to make their report. There are only like 11 or 13 states in the country that have one of those, and Ohio is not one of them. So we are not really sure where to go with that information at this time. So we're trying to figure out how to kind of back up and get a hold of some data to get some realistic numbers to put in front of our representatives. But we have been spending a lot of time mapping out the government and who we want to meet with and who is likely to be a mover for us. And we're working on scheduling. We actually are like scheduling meetings now, which is exciting, to meet with representatives. So trying to get our hands on some bill language, one pagers, some level of that fiscal report to actually have some tangibles to give at our meetings.
Awesome. Fantastic work, Kaylee and Autumn. And just want to say, like, you know, you guys have gone from 0 to 60 in a short amount of time, and just kudos to you for all the knowledge and, you know, work that you've done to dig in and get Ohio prepared. And kudos to Shanice as well for jumping in to help coach through that. And I think it seems like we keep reiterating that the regional concept might be one that's a good idea here. So I took note of that. All right, we've got Oregon, and I believe Dee, who's riding her bike. Hopefully you have stopped riding your bike, and we'll give your update.
I did. I'm stopped right now. I knew after Ohio. Really short update, actually. So our insurance fairness got reinstated on our last call. So no update there. Just building momentum. And Nicole kind of updated on all that. So like the on events, Hood to Coast, to reintroduce and add more to that bill than next year. So no really big updates except for the events coming up. So that's it. I think nothing else besides those things.
Awesome. Thanks,
You
Dee.
covered it.
And
Thanks.
Dee is one of our co-captains and athletes on our Hood to Coast team from last summer and the summer as well. So kudos to you, Dee, for all that you've been involved on and for helping us get the word out for the event next week as well. It's going to be fun.
Yeah.
All right. Have a safe bike ride and have fun. All right. Tennessee, we've got David. Is David on? David
Hi.
Seaman? Yeah.
Yep. How you doing today?
Hey, good. Thanks, David.
So just a real brief update. We're from a state society standpoint, we're in the process of forming a formal committee and getting roles in place so that we have, so it's not just one or two people, but and having individuals that are focused on the legislative, community outreach, you know, grassroots, all that good stuff. So we're hoping in July to have all those positions filled and in place. And then of course we're working with trying to make contact, quality contact with legislators that are actually in the specific committees. We're one of the states that, you know, I felt like maybe maybe Tennessee was a little bit attacked today about shooting for the moon, because our focus is probably a little bit different. You know, I mean, I'm not afraid to say that we see So Kids Can Move as a little bit of a Trojan horse to actually make action in the state of, you know, prosthetic and insurance fairness and all that good stuff as a whole, because the reality that we face is we can get anything pretty much passed, but it's impossible to get it paid for. And so that's one of the real burdens that we're facing. I'm happy to make a leg for a kid and give it to him for free if I can get everything else paid for. So that's our, you know, industry reality. And as an amputee myself, I've, you know, never turned anybody away, but the reality is sometimes the lights need to stay on so that I don't have to turn people away. But that's my whole, you know, that's another subject. But to wrap it up, Nicole, it dawned on me as we were as everybody was talking about publicity and motion and move. I've actually found myself where I'm going to be involved in a movie that is being produced specifically about amputees and prosthetics. It's the working title right now is called Made Whole. But I'd like to get with you later because I say it's a movie, it's a documentary actually, and it's very much the goal of this movie is very much everything we're talking about. And one of the areas that we want to discuss is, you know, active amputees and their barriers. And so I thought about the Hood to Coast aspects and some of the other things you talked about. So I'd like to get with you later if that's possible.
Yeah, absolutely. Would love to chat about that with you. And I love the name already, Made Whole. I think that is that's powerful. Absolutely. We'd love to to find ways to get the word out on this. And I think a documentary of including that in some sort in this would be amazing. So yeah, let's connect.
All right, thanks.
Yeah, awesome. Thanks so much, David, for the update there. And just to the point on the kind of model legislation, and I hope no one felt attacked in that process, even though you did say you felt attacked in that. So I apologize for that. I think we are, you know, exploring pros and cons to every angle. And I think what's important to know is that when we started, we didn't even think we could get all ages covered, and look at where we're at now. So I think it's important for us to have states shoot for the moon and pilot things while also maybe being conservative in other states. So I think we can have a win-win scenario pursuing all of it. So just want to make sure everyone feels like if they're doing it in one approach, that doesn't mean it's wrong. Every state is different and every scenario is different as well. So
Yeah.
thanks for all the work that you guys are doing in Tennessee.
Yeah, and actually, can I just speak to that for half a second? You know,
Yeah.
for us, like when I look at active specific prosthetics for a child or a shower leg for an adult, it's the same thing. It's activity specific prosthetics, and that's just verbiage. I'm not going to go and fight for someone to get a shower leg because personally, I think that's a waste of time to fight for from a legislative standpoint. But fighting for people to have access to their daily life is what it's about for the state of Tennessee, and that's where we're going. So I see it as one. We're focused on one thing.
Yeah, absolutely. I think at the end of the day, we've had to bucket things into different categories, but if we look at it, it's all about just access to everything that anyone else has in their daily life as a person with 2 limbs or 4 limbs, with all of their limbs. It's access to mobility, access to well-being. So I think that's something for us to continue thinking about of how we have to, why is it that we have to bucket things into categories for this community? So love the way that you're thinking on that. All right, last but not least, we've got Virginia and Shri. I see you're on the call. I'm not sure if Jess is, but would love for you to take the lead and on the update.
Yeah, hi. So for Virginia, we just got started in the sense of Jessica Norell and myself will be the leads. That is honestly as far as we've gotten. We set up an email address, a Gmail for anyone who's interested or any kind of communications we have to have a central place for it. So it's so VA can move at Gmail. And aside from that, we just set up actually a meeting with the Amputee Coalition side of the house to get some like rundown information from where like state resources are. And we met with AOPA 2 weeks ago now. The idea of having a checklist and a to-do list is something that we really like. Sam had provided kind of an outline of between when we met and July 7th. So we set like a 1 month out meeting date. And I think that is a really great one for us, honestly. Gives us a bunch of resources to review. And I'm sure that it will be part of the more formalized toolkit, but because we want to introduce legislation at the start of the new calendar year, we're in roughly about 6 months out from having all ducks in a row.
Fantastic. Great work, and excited to have both of you guys bring in Virginia to the table on this too. All right, Ashley, I think you had your hand raised.
It was just to add that we do have a champion in Virginia. Delegate Rome, Danica Rome is going to be the champion and is incredibly interested and has been the champion to add microprocessor technology to their insurance fairness law, and is still very engaged. And so Shri has that's like a, you jump ahead a little bit when you have someone that is that knowledgeable and cares about the space. So
Absolutely. Well, and thank you, Ashley, for the work that you've done in building that relationship with Danica and, getting her excited about orthotics and prosthetics. I think that's the reason she's a champion is because of you. So thank you for that.
not just me, it's been the constituents living
Yes,
limb
yes.
loss that she has, have come to her, and she has so graciously heard their stories and shared their stories and got additional buy-in from other delegates in Virginia. So that part will likely be the easy part. It's all the decision making in between now and then that will have to happen.
Awesome. All right. Well, we are 15 minutes over time. We might think about expanding this meeting to be an hour and 15 if that's of interest to people. But that's the end of our state updates. If anyone didn't get the chance to give an update that wants to, feel free to chime in. Otherwise, everyone have a absolutely wonderful weekend. I'll stay on for another minute or so for anyone who wants to get a question or ask anything for myself and Sam. Or Joy as well, or any of the Amputee Coalition partner organizations. So yeah, thank you all so much. Amazing work and excited to see you guys at our next call. Thanks, everyone. See ya.
Thanks, everyone. Have a great weekend.
Thanks, Angela.
All and Joy and all.
Bye.
Good to see